Good morning, everyone. Good morning and welcome. Welcome to everyone online, and it is wonderful to see everyone here in person. We have an incredible 2025-2026 Grand Rounds season for you this year, thanks to Savannah Ryder and our Grand Rounds Committee. I'm Noelle Spears. I'm the Vice Chair for Education for the Department of Pediatrics, and as we do every year, we have an incredible State of the Department given by our very own Dr. Terence Dermody. It is my privilege to introduce him. Welcome, Dr. Dermody.
Thank you. Thank you, Dr. Spears. Welcome, everyone. Welcome special guests who have joined us this morning. We truly have a worldwide audience this morning listening in. I'm very, very grateful. It's just a pleasure to welcome you all to the State of the Department address in the year 2025. And I have to say, this is a talk that can be liberally interrupted by applause. And I'll start right now. Fellow Childronians, the state of our department is sound. Indeed. Indeed it is, and you're going to hear many, many accomplishments by our colleagues. So many members of the children's community contributed to making us the best again this year. I wish I could acknowledge all of the accomplishments of which I've been made aware. It's so many, but I'm going to highlight several, and I'm really looking forward to doing so. There are many, many people who contributed to this slide deck. I'll mention some of their names as I move through the presentation, but suffice to say, it took a village to build these slides. And I didn't count the number of photographs of people, but I bet it tops 200 or so, which is, as you'll see in a moment, not even half the size of our department and not even 10% the size of our children's community. Just amazing group that we have. Okay, so let's begin with a game plan today. First, we're going to start with our people, and I want to highlight just who we are and who makes up our team. I then want to provide some education and training updates, and then I'm going to describe some major discoveries, present some research awards, and yes, I know what you're thinking. There will be big checks, and I'm telling you, really big checks this year. And one new beginning I want to describe. And then a couple of key clinical service accomplishments and highlight a couple of our clinical service lines for you all this year. And then I'll close up with some acknowledgments of our superb divisional and executive leadership. So that will be the game plan today. Before I say another word, my first great thanks of the morning goes to the Rangos crew. Indeed, thank you. Thank you. Aaron, Raiden, Terry, Mary, and Jamie, these are wonderful people responsible for light, sound, video, my hair, makeup. They're an amazing, amazing group, and I'm incredibly grateful to them all. So I want to begin with our vision. In our vision, on top of this beautiful painting by Claude Monet as interpreted by ChatGPT, is to be the worldwide leader in pediatric healthcare, education, and discovery. And we seek to lead because the problems that are important ones, the ones that we want to solve the most, are large, complex, difficult problems, and we're not going to solve them by ourselves. We need large teams to work together to solve these problems, and to form these teams, we need to lead. We need to bring people together who share our passion and work hard for them so we can achieve these goals. This is our goal, to be the best, and you're going to hear in the next hour many examples of our team exceeding those expectations. Okay, I want to break some news at the beginning of my talk this morning. Our Office of Diversity, Equity, and Inclusion has been renamed to the Office of Engagement. This is to be consistent with university and health system naming principles. And I just want to share that our Office of Engagement will continue to be led by Loretta Mateo, who is our Vice Chair of Engagement. And she's ably assisted in this efforts by two Associate Vice Chairs, Sylvia Wusu-Ansa and Maya Raghavan. Our goals have not changed. And just to be very clear about articulating our goals, our North Stars here, we're going to recruit strong teams, teams that reflect those who we serve. We're going to support community-partnered health systems research, and we're going to foster a culture where all can thrive, everyone in our community. And if that sounds a little bit to you like diversity, equity, and inclusion, that's intentional because our goals have not changed. Our goals have not changed. I want to thank this group so very much for the hard work they do. Thank you. Okay, to be the best, we need great people, and I just want to share just a little bit about who we are. We're a very big department now. We consist of 26 divisions, centers, and institutes. We have a total of 432 faculty now, over 100 clinical fellows, over 130 residents, and so forth. And I just want to point out that we guide this group with 30 administrative staff who must work more than 24 hours a day to support these big teams. So when you all have the chance to interact with one of your administrative folks today and in the months to come, please thank them for all the great hard work they do to make what we do possible. When you break down our faculty, 311 are duly employed. They work for both the university and the health system. Most of those faculty are physicians, most based in Lawrenceville and Oakland. 44 of our faculty are largely PhD scientists based here in Pittsburgh. And then 77 of our faculty, UPP only, are mostly in Harrisburg and Erie and in other centers in our pediatric service line. It's a very big group. So when you add this all up, we're now over 1,500 members of the Department of Pediatrics. So this blows through our previous world record and adds another 5 to 8% of total personnel. So we're continuing to grow. So despite all of these challenges that we face, whether they come from federal directives or just the challenges in reimbursement for the care we provide, we continue to grow, which is a testament to our leadership who believes in us and wants to make sure we have the right people to absolutely be the best, and we do. We continue to be a department in which we have far more women than men. We're just short now of 65% women, and that percentage has increased almost every year that I've been here, just to give you a sense. And then I want to thank Rebecca Longo, Mary Jo Chalosky, and Cheryl Ranelli, who staff all of our human resources for the Department of Pediatrics. Now, you may think this is staged, but this is not. These people derive great satisfaction from looking at long Excel spreadsheets and trying to game plan how best we can support everybody. I'm incredibly grateful to them. When you look at the ethnicity of our faculty, most of our faculty identify as either white or Asian, but we're making inroads in increasing the numbers of our faculty who come from underrepresented communities. And that's shown clearly on this slide. This is just a snapshot of the last 5 years of the number of our faculty underrepresented in medicine. And now fully 51 of our 432 faculty, or just short of 12%, identify as underrepresented in medicine. And this is about double in the last 10 years. And I can't thank the Office of Engagement enough, our division directors and our vice chairs, for all the hard work they're doing in recruiting faculty who help us reflect the community we serve and make our team stronger. Let us thank the Office of Engagement. The distribution of our faculty by rank is shown on this slide, and you can appreciate that our instructors and assistant professors have a high percentage of women, a little bit higher than the overall number in our department. And for the first time since I've been here, the number of associate professors is now almost at parity with the total number of percentage of women that we have in the department. That's remarkable. And also, breaking news, for the first time, the number of full professors who are women has tipped 40%. So that hasn't been done before. And so we're incredibly grateful to the hard work of you all for doing the amazing work that serves to promote you. And we're really grateful for that. And I want to thank our Office of Faculty Development. That's helmed by Sylvia Choi and Erica Freeling. And I also want to thank Rick Saladino, who helms the promotion process. And Rick is now approaching 1,000 CVs that he's looked over and corrected punctuation and grammar. And I'm really grateful to you, Rick, for doing all of that hard work. Can we give it up for the Office of Faculty Development? Indeed. And we continue to promote women into leadership roles in our department from our large group of incredibly talented women faculty. This year was unlike any other in terms of the number of women we appointed into leadership roles. You'll see some examples of that in the slides to come. And now the number of women leaders approximates the percentage of women faculty in our department. So we're working really hard to ensure that we're inclusive, representative, and have teams that reflect the communities we serve. And there are a lot of people who get the credit for that. Vice chairs, division directors, or hospital leadership, I thank them all. And you can too. Okay. 14 promotions this year I'm very proud of, and I just want to call these folks out. Andrew Bukowinski, Tyler Harris, Todd LaMattina, Mia Manoli, Andy McCormick, Anita McElroy, Julia Mead, and then also to call out Hiran Muzumdar, Laura Olivieri, Kirsten Rose Felker, Sunny Sims Lucas, Jane Taylor was promoted, Allie Williams, and Toby Anowitz. All of these faculty promoted to associate professor or professor, and congratulations to all of them. Amazing work. Amazing, amazing work. Thank you. Thank you. We had, one notable retirement this year that I wanted to bring to your attention. After an almost 25-year tenure at Children's Hospital of Pittsburgh, Dr. Kristen Hannibal retired. Kristen was the clinical director of the General Academic Pediatrics Division, and she also was the clinical director of the Child Development Unit. A pediatrician's pediatrician who cared deeply about patients, families, the trainees she had the good fortune to work with, as well as her colleagues. We're incredibly grateful to Kristen for all of her contributions to children. So let's just acknowledge her efforts. Terrific. Thank you. We had many, many awards to celebrate this year. And when I compiled my list in preparation for this talk, the number of awardees exceeded 50, another high watermark for the department. And I wanted to present all 50 of them to you, but we only have 4 hours for this presentation, and I was unable to really coalesce that to include all of those in the slide deck. So I'm going to present to you a dozen that reflect the diversity of the awards that our faculty have received. So Amber Hoffman received an award, one of 3 this year, Clinical Clerkship Preceptor of the Year. Daniel Keats received the Cure Juvenile Myositis 2025 Clinician of Excellence Award. Kate Levins, another Clinical Preceptor of the Year award. Andy McCormick received our 2nd Justice in Equity, Diversity, and Inclusion Award. Gisela Munez was selected for the ELAM program in Executive Leadership and Healthcare. And then Evelyn Reese received the Fraley Award for Medical Student Mentoring. But there's more. Nader Sheikh had a paper picked by the Clinical Research Forum as one of the top 10 in the United States of America for clinical research achievement. Just amazing. By the way, that's one of 3 we've had in our department in the last decade. Kiki Torres received a Social Justice Award from the School of Medicine. Jerry Vockley was selected by the National Organization for Rare Disorders for being a medical and scientific trailblazer. Anna Warren Erickson received our 2nd Advancing Women in Pediatric Medicine and Science Award. And finally, Allie Williams received the Society for Hospital Medicine, a national society, PHM Award for Excellence in Clinical Care. Wonderful accomplishments by these and many, many of our other faculty for which we can be proud. White hot off the press is the award for UPMC Excellence in Patient Experience that would be given to 3 members of our community this year: Elaine Cassidy from rheumatology, Jim Felker from hematology and oncology, and Jessica Osmond, who is a primary care pediatrician in Williamsport, which is sort of north, central, a little bit east. You pass through it when you drive to Ithaca for those who get to the Finger Lakes. Beautiful. Incredibly proud of this group. We had 3 ACES awards this year. Andrew Buchert, Mark Dovey, and Levi Shelton all received UPMC ACES awards. This is an incredibly prestigious honor. Fewer than 40 in the whole UPMC system that received these awards. We had 2 additional awards just to let you know. Physician Excellence Awards were provided first to Colleen Matthews in Hematology and Oncology. This is a new Physician Excellence in Clinical Care Award. And Sylvia Choi in Hospital Medicine received a Senior Physician Excellence Award in Clinical Care. Young and more senior role models for which we all can be proud. Let's give it up to them. Well done, Colleen and Sylvia, indeed. Just a few more before I leave this section. I want to acknowledge John Ibrahim from Newborn Medicine. And John was inducted this year into Society for Pediatric Research. And then Amr Sawala in rheumatology was inducted into the Association of American Physicians. These are very prestigious national honorary societies. And I want to thank members of these societies, as well as division directors and vice chairs who are working hard to increase the number of nominations so our world-class faculty can be recognized throughout the world. So there are going to be a lot of nominations this year. I was incredibly pleased that our very own Maggie Holtz received a UPMC Physician Assistant Preceptor of the Year Award. She's the APP supervisor in the Division of Pediatric Hematology and Oncology, and this is wonderful, wonderful recognition for one of our very own advanced practice providers. Let's give it up, please, for Ms. Maggie Holtz. Thank you. Thank you. And then one last award to share. And this is an award that was given to Jeff Curlin, the inaugural Robert Lynn Humanitarian Award. This award was given by the Western States Endurance Run Board. I didn't know much about this, but I've learned that this Western States Endurance Run is a 100-mile race that Curlin himself has completed twice and works to help folks who are a little short of breath running the 100 miles during this race, and really recognizes the wonderful contributions to humankind that our very own Dr. Jeff Curlin has made, and we should all recognize what a wonderful colleague he is. A pic of Jeff receiving the award with 2 of his colleagues. Okay, I want to move now and spend a little bit of time on education and training, and then a little bit of time on research, and then a little bit of time on clinical care. I want to acknowledge our wonderful educators, and we have many. And I picked this photograph of Diego Chavez to show you, of course, a world-leading educator, and here he is getting ready to throw the first pitch at a Pirates game. This is true. After instructing that Mr. Paul Skeens how to throw that slider, and which is working for him now, thank goodness. And so, and thank you, Diego, for your wonderful work. The Office of Education is led by Dr. Noelle Spears and a wonderful team she works with. We have lots and lots of learners in our environment. In truth, we're all learners, and the Office of Education coordinates learning activities for so many of us. And I want to give a special thanks to Savannah Ryder, who supports all of these efforts in the Office of Education, and a special thanks to Savannah and Noelle for helming like the best grand rounds of any department on any planet in the universe. Thank you. Thank you. Thank you. Pediatricians love to teach. Absolutely, they love to teach. In fact, the commitment to teaching, to working with families and children and helping them understand and grow forms the motivation for so many of us who pursue this career. Some evidence. These are the faculty members who are involved in the Three Rivers curriculum, now entering its 3rd year. And fully 43 members of our faculty are engaged in some type of teaching or leadership role within the Three Rivers curriculum. This is a high watermark for the entire school. I don't know what second is, but it's not even close to 43. Our UME efforts are led by John Smuziak and Vildan Tass, and I thank them both for all of the work they do in leading the clinical clerkship and also the 4th-year elective program. But I also want to thank Drs. Hayes, McCaig, Panko, Sensenig, Williams, and Sircone for so much hard work that they do in supporting our medical students. And all of this is lifted up by Marlyn High, who is the administrator who looks after, 300 medical students and about the same number of faculty and does it with that smile on her face all the time. And it's just wonderful. We have a superb residency program. I think really the best residency program in the world. And this residency leadership team would say that's because we have spectacular residents and we have spectacular faculty and spectacular nurses who work with these residents. That's all true. But great programs have great leadership, and I can't think of a more effective group of humble servant leaders than those who lead our residency program. Andy Nowak, Kate Watson, Matt Valenti, Katie Pollack, Jen Wolford, Vilden Toss, and Rhett Lieberman. Let's thank them very much for leading this program. Indeed. So this group may direct where the planes fly, but the pilots, of course, are our chief residents, and I want to thank them very much. This is our current group of chief residents, Sarah, Lisa, Allison, and Catherine, who I'm getting the chance now to work with as we're now, for the third year, implementing our leadership curriculum for our residents. We have a case-based leadership curriculum for second and third year residents, focused on leadership and career development. Very excited about that and very excited to be working with the group of chiefs in delivering that curriculum. Everybody involved in the residency program would say, yeah, that's all true. But the nervous system of our residency program is really this group of people. Our residency administrative team, Mariah, Vandra, Benny, Leanna, and Tabby, and many of them are here, and I would like to thank them all for the hard work they do leading the residency program. Super well done. Super, super well done. Our teachers are accomplished, and we collect evaluations from our residents about teaching effectiveness. And when we have 5 or more, we group those and just make an average and line them up. And we pick always the ones that score in the very top, the top 10. And I have to tell you, the top 50 are really, really close. So I'm not sure that the top 10 are statistically significantly different than the next 10 or the next 10 after that. But nonetheless, math is math. And these are our top 10 performers in resident education. I'm going to call them out: Sylvia Choi, Aaron Cummings, Nicole Dobson, Scott Maurer, Katie Pollack, Kirsten Rose Felker, Jackie Saladino, Betsy Sensening, Arvin Srinath, and Allie Williams. I've shown in green first timers on the top 10 list. And then there's some that are just sort of lifetime members of the top 10 list, it seems to me. But well done, teachers. Well done. Let's thank them. Well done. All right, our fellowship leadership team is, of course, led by Becky Chiaffi and Arvin Srinath and Noelle Spears. These 3 people, along with all of the fellowship directors in the division, we realize we have 20 fellowship programs in the Department of Pediatrics. So a lot of people involved in leading our fellowships. But these 3 people spend the majority of their effort guiding strategic planning and then working all of the mechanics so that our fellows have useful and rewarding training experiences. We did really well in the match this year, and I just want to share some top-line results with you. We had 44 positions we were recruiting for in our residency. We matched 44 positions. You can see the distribution of our residents, including our first resident in pediatric genetics. It's a brand new program that we started this year. And we recruited 30 subspecialty fellows. We wanted to recruit 36, but recruiting 30 of 36 in this incredibly challenging climate to recruit fellows into subspecialty pediatrics is a huge victory, a huge win. And so great thanks to our fellowship leadership, our residency leadership, and a lot of division directors and faculty who interviewed a ton of people to land this residency match. And so our education is super. It makes us incredibly strong. I just want to acknowledge all the educators here and listening in from afar. All right, I'm going to shift now and talk a bit about major discoveries. And I'm going to present some research awards. And the Research Award Selection Committee is shown here, and I'm grateful to all of them for reviewing the numerous nominations that we received. Realize you all, the Department of Pediatrics, final numbers aren't in, published around 600 papers in the last academic year. I mean, it's just amazing. And we had between 30 and 40 nominations for these awards, and it was really difficult to pick the winners, I can tell you. And I want to thank Sam Roscoe and Nancy Harder, who helm research administration for us. Sam is responsible for compiling lots and lots of data for us, financial data. But I also want to thank Vince Council, Zach Budovich, Zoe Swartz, and others for compiling lots of the data that I'm going to show today. Okay, so I'm going to start first with health services research, and I'm going to present 4 awards. We're going to have some picks, and I'm going to tell you a little bit about this work as the award recipients are called right here to this stage. Okay, so first, the award for health services research goes to Christine March. This is a faculty award, and I also want to recognize the DOP faculty colleagues who are authors on this manuscript, Ingrid Libman and Liz Miller. Good evening, Liz. Liz is calling in from Kobe, Japan, shares her regards with all of you. Please come forward. This is an amazing study. And Ingrid, you can come too. You absolutely. This is an amazing study that was conducted to prepare for a school-partnered intervention to improve the health of children with type 1 diabetes. And the strategy was to bring together a diverse group of community stakeholders, patients, families, and representatives from schools and the health system together to, as Liz Miller would say, work to plan the intervention that the community thinks will work best. In other words, the secret sauce of this work is to make the table large enough where everyone has a seat. And so I'll just share in this planning stage, they identified several areas or opportunities that might pose obstacles for the implementation of a school-partnered diabetes care program. And I show on this slide from their manuscript the most important ones, like accessing a virtual platform or secure data sharing. So they compiled a dozen or so of these and then developed strategies where they could alleviate these potential problems. And now Dr. March and her colleagues are all ready for a big pilot that will then launch to see if this program will work. Super excited about this. I have certificates for you all. Christine, that's for you. Congratulations. Liz, we're going to mail yours to you. I was not kidding. Where's it? Where's it? Where, Daniel, where are you? Thank you. I mean, this is going to be beamed to the world. Okay, well done. Congrats. Yes. The big checks are for $1,000, and that can be used by Dr. March for anything to support her scholarly efforts. So unrestricted funds from the Department of Pediatrics. Our next award is our next award is in the category of clinical research. And I'm very pleased to present this award to Dr. Anne-Marie Rick for her study that identifies factors that are associated with the non-prescription, the failure to prescribe oseltamivir, Tamiflu, for infant influenza over 9 seasons. And I also want to recognize Judy Martin. Judy, are you here? Please come. Indeed. Recognize both of them. So, as you all know, oseltamivir is recommended for all children less than the age of 2 who have flu. but not all children receive oseltamivir. So what Anne-Marie and her colleagues found in this retrospective study of just short of 460 children, that about 86% of all kids received oseltamivir. So we have room to improve. So why didn't they receive it? Well, if they were seen early in the study interval, they were less likely to receive it. If they had flu symptoms that were longer than 2 days, they were less likely to receive it. And if they received a test that diagnosed flu that took a little bit of time to return, as opposed to an immediate test, they were less likely to receive it. This is the kind of work that changes care, because now we can get in and provide lots of education about how to do this better, and hopefully we get this number much closer to 100%. Research that changes our healthcare. Very, very grateful. So, okay. Anne-Marie, that's you. Judy, that's you. I got a big flight. I got a big hip. Alejandro, Anne-Marie may need a larger office. Great, thank you. Thank you. Okay. Next up is in the area of translational research. Research that involves both human subjects, but also a laboratory, with the idea that what we learn will help us provide better care for the kids we care for. So the award this year goes to Cristina Galletto, who shared first authorship with student Malin Yu on a beautiful paper in the Journal of the American Medical Association, JAMA, on transcriptomic profiles in the nasal epithelium associated with asthma endotypes. I also want to recognize her co-authors, Francisca Rosser and Juan Celadon and Wei Chen, for contributing to this work. Juan is away, but I think everyone else is here, and please come forward. Christina, Francesca, Wei. Okay, thank you all. That's yours, Christina. Francesca, that's yours. Wait, that's yours. Congratulations. I'm going to give you this one to give to Wei. I need to talk a little bit about your work. Okay, this is what you're going to hear is amazing. This is world-rocking work that I'm going to present to you now about one of the most common conditions that have in children that we care for here and elsewhere in our country. So asthma is a complex disease. The clinical manifestations you all know well, but the underlying root causes are not clear. And then how the immune and inflammatory response reacts to these root causes, that's not clear either. But there are clear phenotypes, different components of the immune system that are responsible for asthma. They can be easily characterized or simply characterized, I don't know about easily, but simply, into type 2, type 17, and neither type 2 or type 17. Now, 2 and 17 relate to these immunologists, they relate to interleukins that drive these different immune response. The type 2s are the ones that are like allergic, high levels of eosinophilia, lots of allergy, and they respond to lots of new biologics that are on the market. These biologics work for those group of children with asthma, but they're super expensive and they're not risk-free. So you'd like to know who exactly had type 2 asthma before you prescribe such a drug. Okay, Galletto and the team, amazing work. They took advantage of 3 cohorts that Dr. Celadon has been studying for some time. The STAR cohort with 156 participants, this EVA PR cohort with 237, and then the vitamin D kids study with 66. So all in all, this is a big group of study subjects, and they had nasal washes saved for all of them. So what they did is they used those nasal washes to figure out whether the profiles in those nasal washes were more indicative of type 2, type 17, or neither. And here, we'll just use one as an example. This STAR cohort, all of these children here with red for the type 2 marker have type 2 asthma. And then these children who have red in this middle group, they have type 17 asthma. But this group have neither. So clearly only this small cohort would benefit from treatments that are directed onto type 2 asthma. So when you add it all up, type 2 high was present in the distinct minority of children with asthma, less than 30%. 35 to 47% or so had type 17, and then 30 to 38 had neither. This is amazing work, and you can imagine how, if you could put these things on little chips for in-office detection, which is totally feasible, you can make these diagnoses, bam, and then give treatment that is directed at the type of asthma the child has. This is just wonderful, wonderful work published in a super high impact place. Christina, who had a baby like 3 weeks ago, thank you for coming. We need to just recognize this is amazing stuff. Well done. Okay, now we can't cover up Christina's face. Right there, right there. Okay. Terrific. Well done, Dr. Okay, one more. Y'all okay, one more? Okay, we have one more award to bestow, and that's the award for basic research. And we had a lot of nominees in this category. And I have to say, as the nominees were being discussed and a final group was decided upon, John Alcorn excused himself as a member of the selection committee because, in fact, his paper, published in the Journal of Clinical Investigation, was selected as the award winner for the basic research category. Let's give it up for John. Now, John can't be with us this morning, and Lee Miller, who is the first author of the paper, Lee was a graduate student with John. She's now a postdoctoral fellow at NYU. Neither could attend, but Brooke Desden is here to receive the award for John. Now, if you think there may be a theme with the lung this year, I tell you, that's just how it worked out, just how it worked out. What John and his team found is truly amazing, that antibody responses that we develop to some strains of flu stay in us and help us when we're challenged with another strain of flu and make bacterial pneumonias that come after that less severe. And it's all about antibody responses that just keep flu at bay. And you might be thinking, what induces an antibody response other than natural flu? Well, that would be a flu vaccine, and vaccine season is upon us, and we'll be vaccinated proudly against influenza. Indeed, we will. Because we don't want to end up like these mice. And so here's the story. These are wild type mice, never been immunized, and these are mice that are unable to mount immune response, an antibody response. They have no B cells. And what happens is when these animals are infected with influenza, and then 60 days, 54 exactly, days later, challenged again with influenza, and then infected with staph, they get a lot worse pneumonia when they have no antibody responses. And that's shown by all this yellow stuff in the histology of the lung from these mice. This is all quantified in the paper. And what John found is that in the absence of antibody, cytotoxic T cells infiltrate into the lung and cause tons of damage. And so antibody keeps flu at bay so that the damage is not as great, which is an amazing thing, and yet another reason why we need to get flu vaccines when it's time. And Brooke, for you all, and that you're here, let John know that you can have half of the big check. There you are. Just thank you. Okay. Now, a couple of other things I want to just share. If you want to hear more good science, on September 25th, please come to the Women in Science Symposium that afternoon. You're going to hear great talks about the diversity of discovery in the whole children's community. This is a symposium that is inclusive. Everyone's invited. The common theme is great science, and you're going to hear great science presented by great scientists. So please come. You won't be disappointed. I want to just spend a second on research funding, a question that I'm commonly asked. This year, this fiscal year 2025, so ended June 30th, the entire research portfolio for the Department of Pediatrics was just short of $65 million. That's about 700 million less than it was last year. And this is despite losing just over 1.7 million in federal grants that were terminated for one reason or another in these NIH maneuvers that have occurred this spring. This is amazing accomplishment, being able to maintain our level of funding despite these challenges. The lion's share of our funding comes from extramural funders. NIH accounts for about 45% of our funding, but we receive funding from lots of sources, various contracts and industry and foundations, in addition to our foundation, which I'll come to in a moment. A lot of awards, just to share briefly. We had 4 new K Award recipients. Taylor Eddins, Katie Pahalik, Aiden Porter, and Glenn Rapsinski all received K Awards this year. This is a big deal. Yeah. Well done. So the launching pads for our physician scientists, and we're incredibly grateful. We had 13 major grants that had funding annually greater than $250,000 a year. And just several of these here, I want to highlight a couple. I want to highlight Radhika Muzumdar's T32 to support the training of pediatric endocrinologists. And you know, success in science is directly proportional to the thickness of your skin. And I don't know anybody who has a thicker skin than Radhika in applying for this application. You talk about shots on goal, my gosh. And so perseverant to get this funded, and it is funded, and we have great trainees, incredibly excited. I highlighted these R01s that were earned by Maya Raghavan and Lori Silva. These R01 grants represent the first grants, R01 grants, by these 2 accomplished investigators in our department. These are really the main independent NIH grants that really fuel the majority of research that we do in our department and countrywide. So incredibly proud of them for that accomplishment. And just staying right on it, Mary Ellen Vajravelu also received her first R01 grant. So we had 3 members of our faculty receive first R01. So I just want to acknowledge those folks. Good stuff. I've shared with you a little bit about our very newest initiative. It's the Genetics, Genomics, and Growth Center. And just a couple of points this morning. This center is led by Arjun Ghazi, Eric Getzman, and supported by Anna Marie Parolo. Anna Marie also supports the Children's Neuroscience Institute and the Eye for Kids. She's a busy, busy woman staffing these 3 major research initiatives. The G3C was established earlier this year and has as its main goal to advance transformative science to improve the health and well-being of children diagnosed with genetic conditions and disorders. This is really a focus on taking science and developing new strategies for care. Science with a care reach. Really, really grateful to Arjun and Eric and all members of the G3C for taking on this work. Be on the lookout for their first symposium, which is being planned now, and also a pilot grant program that they're going to be initiating this year too. Both of those are going to happen this year. Exciting. Some thanks here for the research domain. Our clinical research team is spectacular, which is shown on this photograph on the left. And I want to acknowledge Dr. Silva Arcelanian, who directs our Pediatric Clinical and Translational Research Center, and Dr. Alejandro Hoberman, who is our Vice Chair for Clinical Research and leading these clinical research efforts. And I also want to acknowledge our amazing research administrative management team. This is a team that's led by Nancy Harder, and as a servant leader, Nancy is not on this slide, but I did show you a picture of her before. And I just want to thank the many, many hardworking research staff who focus on pre-award management, post-award management, facility management, communications, and IT. Just a great group of people who stand up our discovery efforts. And why don't we thank all of these folks now? Okay, just now some additional thanks. And these thanks could be labeled thanks to our sponsors. We have a spectacular foundation, a group of incredibly hardworking people who believe deeply in our mission and deeply in us. And I am so grateful to Rachel Petroselli, who's the president of the Children's Hospital Foundation. Rachel is watching this morning, and her leadership team, Karen Depperman, Larissa Graddick, Greg Keegan, and Robin Weber, who together lead the foundation forward in an incredible number of fundraising activities. There may be a group of kinder, more creative, more hardworking people raising support for children's care, education, and discovery, but I haven't met that group of people. And so I just am so grateful to Rachel and her team for their efforts. And efforts, oh my gosh, many, many efforts they've made. This is a bar chart of fundraising activities since, golly, fiscal year 01, so 25 years of amazement. I want you to focus on the purple bars because those represent funds raised less than $1 million and truly are the earmark of a hardworking team working to raise funds from lots and lots of sources. And I know many of those sources are sitting in this room, and I thank you for supporting Children's Hospital and supporting our mission and directing those donations of yours to wherever you think they're best used. You know, like reovirus research, but whatever you think is a good place to direct your funding is terrific, and I'm grateful. You all know we're finally in the final stages of our capital campaign. That's the This Moment campaign. And I want to thank our campaign co-chairs, Vanessa and David Morehouse, Diane and Cliff Rao, and Joan and Peter Stevens. Sadly, we lost Diane earlier this year, and I just want to acknowledge her incredible friendship, wisdom, and leadership in helping us with the capital campaign. Cliff Rao is here, and I think I want to acknowledge all of the campaign co-chairs and acknowledge that Cliff is here too. So join me in thanking them. Thank you. Campaign has 4 major goals. One of them is to support research, and the campaign has done really, really well. I have to thank Rachel for this fancy graphics that I wouldn't know how to do, but she does, and I'm grateful. We've raised over $42 million to support the pediatric research efforts, and a lot of those funds have been used to support the Mario Lemieux Institute, the CNI, the G3C, and the I for Kids. I want to acknowledge Drew Parrish, who is here from the Mario Lemieux Foundation. Drew, thank you and your foundation for your support of our efforts. Grateful. And then in the last couple of years, we've seen increased support for our campaign research fund, which provides unrestricted funds that we can use to support individual members of our faculty who are engaged in discovery efforts. We now have 27 scholars who have been appointed to these various scholarship groups. And I just want to acknowledge Beckwith's, Conover's, Natalie's, Rao, Shears, and Tulls. They together support these 27 scholars. And also Mark Snyder for the first awards that support several members of our faculty, pilot awards to incent large team science. Noelle and David Conover are with us this morning, and I want to thank them personally for their support of efforts for years in our discovery space. And so thank you for the Conover scholars. Really appreciate it. We've had many clinical service accomplishments this year, many, many, many. And I think it's important just to pause and reflect that we serve as the referral source and the provider of children's care for a catchment area that includes about 5 million people. That's a privilege and an awesome responsibility. And of course, children don't come to seek our care because they want to shop or experience an amusement park. They're coming because they're in crisis and they're not well, and you all take care of them. And it's wonderful, and I am incredibly grateful. When I show you numbers, it's not that we're proud of so many people, so many children who are sick. It's just that we have the privilege of taking care of so many, and I just want you to see that. So you all know in the U.S. News Top 10, which we're waiting for the results to drop later this month, but last year, all of the specialties that were ranked, we were ranked in every single one of them. Proud of that. We continue to be busy, perhaps none other than our pediatric subspecialty visits. I just want to point out that we had a new world record in the last calendar year. This is sort of reflects projected numbers, which we're going to hit or exceed. And then if you compare calendar year 23 to 24, we had an 11% increase, which is absolutely remarkable. And you all know that because you did it and you worked really hard. What that means is that wait times for kids who need our care have really declined. And that's a wonderful thing. And thank you for that. Our emergency department anywhere care group continues to be very busy, in excess of 80,000 visits for the last 4 years. We've clearly recovered after COVID, clearly. And our hospital remains really busy. Now, the years 23 and 24, I think, were a lot of respiratory viruses that were waiting until they had susceptible hosts, and they found them. And we were very busy with those children those 2 years. And 276 sort of puts us back to our high water mark before COVID. You can see that in AY19 when we were 273. I'm really pleased with where we are with that. Just to highlight a few programs, there are dozens and dozens of wonderful programs, and just to pick 3 to share, just to show the diversity of what we do. Our pediatric kidney transplant program is unparalleled, and there are many, many examples of unparalleledness, but I'm particularly pleased with our outcomes. We have 100% 1 and 3 year allograft survival, and that's amazing. I thank Juhi Kumar, who is the medical director, and Armando Ganoza, who is the surgical director of this kidney transplant program. Great work, you all. I want to also acknowledge our infection prevention team. This is a terrific team led for years by Mike Green, and the torch has been passed from Mike to Terry Stillwell, a new member of our faculty. And these folks are driven to decrease hospital-associated infections. Lots and lots of work they do. Poor Terry still has to make sure Mike washes his hands, but this is really, really important work, and I'm incredibly grateful to them and the infection preventionists who they work with to do this work. And I want to break some news here. We're going to start a new practice. It's the Everyday Wellness Clinic. And this is a clinic that will be led by Dr. Tanya Syed. And Dr. Syed has brought together a multidisciplinary team, including adolescent medicine, general pediatrics, and children's community pediatrics together to focus on a holistic approach to caring for kids who are overweight or obese. I'm really excited about this work. We have a lot of need in this area, and I'm very grateful to Tanya and her team for doing this. Our clinical efforts are led by an amazing practice administration group. They're so good that they can actually change the name of the Dream Big studio. This is a true live picture. I didn't do anything to doctor it up. I want to thank Mike Communal, who leads these efforts, but Mike would be the first to acknowledge everyone on this slide, but to especially acknowledge Linda Johnson, Seth Young, and Jamie Falconio, who are the assistant administrators who work very closely with Mike, and a call out to Whitney Lurch. Whitney leads all of our advanced practice providers in the pediatric service line. Incredibly grateful to this group. Please, thank you. Thank you. I needed that nice applause line. Thank you. Okay, just a few slides to finish up, and I want to acknowledge lots of people and compliment our superb divisional and executive leadership. Of course, this is how we pass the torch in the Department of Pediatrics. We cut the cake. And so we have 20 superb division directors, 6 superb institute and center directors. In fact, not all of these folks are in the Department of Pediatrics. George Gittes leads the Mellon Institute, and George is here today. And that institute, with now 30 faculty supporting our scientists throughout the children's community, is amazing. George, thank you for your efforts. Really, really grateful. But when I think about humble head-down servant leaders who work really hard for members of their team, I think of this group. And you all, I don't get a chance to visit with you as frequently as I would like, but I hear about you. And I hear about your good works from this group, and they are so very proud of you. And I just want you to know how hard they work so that you can accomplish your goals. We have some new leaders to introduce. Jeff Rudolph is our new director of gastroenterology, hepatology, and nutrition. I'm very grateful to Jeff for taking this role on. And Dr. Ling Lin is our new director of pediatric infectious disease. Let's thank them both. Indeed. We have a new Vice Chair of Clinical Affairs, and that's Dr. Kavitha Conti. And so, yes, indeed. Thank you, Kavitha. Grateful to you for taking on this role. Kavitha spent, Kavitha's an emergency medicine physician, so she took the time needed, about 48 hours, interviewed a dozen people, and then selected 2 associate vice chairs. And so I just want to call out Natalie Baldaugh and Ali Ramito, associate vice chairs. It was actually longer than that. And thoughtful. Thank you. We have a terrific executive committee in the Department of Pediatrics. These are our vice chairs, joined by Mike Communal. And this group works behind the scenes to support our division directors in all aspects of our mission, providing great care, teaching and training legions of young people, and doing lights out research. They support all of those activities. But we often do things that really aren't in anybody's job description. This is a picture from one of our more recent projects. And when there were some challenges about how and where to build a heart institute, well, they called us to do this work, and we did it, y'all. We did it. It's right there. We'll open soon, right on our campus. Please give it up for our vice chairs. Thank you. So this is my 10th State of the Department address. I'm in season 10 now. It's been a great show. Again, I want to thank the folks who do my hair and makeup for this. It's been a terrific run, and I'm going to start a new tradition. It's always okay to start a new tradition. And I've been reflecting for the last couple of years about people in our community who have made a huge difference and make possible what we do, support us. In other words, most valuable. And this year, our inaugural most valuable player is none other than Mary Stevenson. Thank you. Thank you. Thank you. Now, Mary couldn't be with us this morning, and my heart broke when I heard that news earlier this week, but that didn't stop us from celebrating with Mary so that we could let her know how much we cared for her and ask her how it is that she knows the name of every single person in Lawrenceville. And if you haven't met Mary, introduce yourself, and she will not forget your name. A wonderful person. Our first most valuable player. Indeed. Indeed. Thank you. Thank you. I can't thank enough our amazing children's leadership team and the amazing leadership of our president, Diane Hupp. Diane supports every aspect of our mission and works really hard to ensure that we provide the best care, that we teach all of these learners in front of us, and that we can achieve our discovery goals. And she does this quietly behind the scenes mostly, and helps us raise funds and procure space and suggest ideas, and supports all of us. And Diane, I can't thank you enough for all your efforts in supporting what we do. Thank you. Thank you. Thank you. I also want to give thanks to Anantha Shekhar, our dean, and also to give thanks to Oscar Mariquin. As you know, Oscar is moving to Emory, where he's going to take on an even bigger role in the health system there. And we heard just yesterday that Dr. Joel Nelson, who was the former chair of urology, is going to serve in an interim role replacing Oscar as Leslie Davis, our CEO, sorts through what the best leadership structure for physician services. And I just want to point out that that man is, in fact, Dr. Srinivasan Suresh. You've never seen him with a tie. And I just wanted to point out that every once in a while, he'll, in fact, wear one. I want to thank the administrative team in the Department of Pediatrics. This is truly the flight crew for our plane. There's not a thing we do in our department to support any aspect of our responsibilities that they don't have a hand in or actually do. And please join me in thanking them for the hard work every day to support us. One more thanks and one more slide. I want to thank my lab team and just say it is such a privilege to do science, to decide what problems we want to solve and how we want to solve them and who we want to work with. This is a privilege. I'm incredibly grateful to work with this kind, creative, super smart, hardworking group, and I'm incredibly grateful for the privilege to do science with them. So I wanted to thank my lab team. Thank you. So we're at the top of the hour and pretty darn close to an on-time arrival. And I just want to leave you with a couple of thoughts as you think about academic year 25 into 26. I'm asked probably the most frequent question I receive is about navigating uncertainty, how to cope in a time of great change that in some cases we're not aware that's coming until it does. And I've thought a fair amount about this and about my own work, but also in thinking about our teams and the work that we do. And maybe just a couple of thoughts to guide you as you think about this year, this time of uncertainty. The first and important is to focus what you can control. To take the best care of children if you have the privilege to care for children, to teach and train learners just like you would like to be taught, and to do the very best research that you can. Try and do the kind of research that will change the world. Set your sights high. Avoid distractions as best you can. They make it harder to do the work that you know is important and work that you can control. The second, more than ever, please stay connected with others. Take a friend to lunch. Join a club. Volunteer at a school or something else, even if it's only a few hours a month, just to get to know people, know their stories, share yours, stay connected. And perhaps the most important to leave you with is to choose optimism. We're all leaders, all of us. We lead teams. Sometimes that team is just one intern and one student, and sometimes that team is a big division or a center. But we all lead. And we need to lead forward with optimism, the sense that the future is going to be better than the present, to instill hope in members of our team. It's going to be better, and we can do it. And I'll tell you, the leaders who lead with optimism can expect from their teams great things. And I'll close the State of the Department 2025 by thanking you because I expect great things, and every single day you exceed my expectations. Thank you, Department of Pediatrics. Thank you very much.